Hello, everyone. Welcome to today's lecture. In today's lecture, we are going to discuss diseases that affect our cardiovascular and lymphatic systems. So these are the diseases we'll be discussing today: endocarditis. We have the first one, which is endocarditis. We have second one, plague, Lyme disease, infectious mononucleosis. We have anthrax, malaria, AIDS, Ebola, dengue. So dengue. And then the 10th one, which is Rocky Mountain spotted fever. Okay. So now the first one we will discuss is endocarditis. This is a sorry, I'm coming. This is an inflammation of the inner. This disease causes the inflammation of the inner lining of your heart and most of your heart valve. So what it does is it damages your heart valve and then the prosthetic heart valve, then leading or predisposing patients to endocarditis. So it can be acute and it can be subacute. There's a high fatality rate for the acute endocarditis, and then the subacute one have a slower and less pronounced rate. Symptoms include you having a heart attack because obviously they're affecting your valve. You also have abnormal heartbeat. You have fever. You have Janeway lesions and then oscillus nodes. So as we can see from here, we have the oscillus node present within your the underneath of your feet. Then we have the Janeway lesions, which are more of a non-painful markers on your palms, which we can clearly see from here. This disease can also be caused by vascular trauma or also circulating immune complexes, which are non-infectious. So there is not only one way of which you can get it. These are caused by mostly Staphylococcus aureus, Staphylococcus pyogenes, and Staphylococcus pneumoniae, and also others. This causes the acute one, and the subacute one are caused by oral streptococci and among others. The transmission is mostly through parental, and which is for the acute, and the subacute is transfer of the normal biota to your bloodstream. Next on our list is plagues. The plague, which is basically the Black Death. There are three manifestations of plague. The first one is pneumonic plague, which is a respiratory disease. The second one is bubonic plague, which is infection and inflammation and the process of your lymph node, which is known as the bubo. And then the mortality rate reaches are around higher, and even with treatment, we get around 15% of mortality rate. The third one is septicemic plague, which is intravascular coagulation and subcutaneous hemorrhage and also purpura, which degenerates into necrosis or gangrene. So clearly, as you can see from here, which you have an intravascular coagulation. Basically, you have your blood which is clotted, which blocks the flow of blood, specifically within that vein that have it. They have about 30 to 50% mortality rate, even with treatment, and without it, basically leading to 100% mortality rate. Because if all of your there's a lot of blood clots within your body and no blood is flowing, you are going to die. The name Black Death came from you having a darkened color on your skin in symptomatic plague, which means there is black clot, which when you have black clot, it tends to be blackish, and then it will basically lead to death if there's no intervention. Death can occur within 2 to 4 days if no treatment is being administered. It's caused by Yersinia pestis, and transmission is through biological vector, which is flea and also droplet contact. Um, the and also we also have direct contact. You also can get it when you have a direct contact with bodily fluid. There's been about 95 percent cases in Africa, but still we have some cases also within the US. So how does plague transmit, or what is the infectious cycle of plague? Basically, you have let's say this is the infected animal, which is basically the reservoir. That's the mouse. So you have a mouse which will transmit it to the other mouse. Then you can have reservoirs such as flea, which will infect chipmunk. Chipmunk dies, and then flea picks it again and send it to say another amplifying host, such as the ground squirrel, and then the ground squirrel will also have the flea, and then cycle continues. Or from the chipmunk, you have a flea which will then also can infect sorry, can be parasite to humans. And then let's say the bubonic plague happens within this human, this man also send it to the female who will also have it. This is caused by accidental hosts, which are humans, because that's not the main places where the plague should be. So as you can see, it's more complex as the more you go on moving from the flea, which is more of an endemic reservoir, to humans, which are more of the accidental hosts. And the next thing to talk about is the Lyme disease. So this is a slow-acting but progressive syndromic disease, and sometimes some of the symptoms include percentage developed characteristic bull's-eye rash, where you have an clearly, as you can see, looks like a round eye-ish, or that's why we call it the bull's round eyes. This was first discovered in Old Lyme, which is in Connecticut in the 1970s, but it's been around presently for centuries. Basically, the Borrelia invades, which is the causative agent. It invades the immune system by changing surface antigens, and it has been known to have multiple proteins, which is responsible for attachment of the parasite to your host cells. Um, some of the side effects or the symptoms of you getting this parasite or getting of this disease include you having fever, headache, stiff neck, you have this dizziness. In some cases, it will progress to cardiac and neurological symptoms. It develops into crippling polyarthritis, and after which 2 months, you can it gets more severe. It's caused by Bolera bulgophorin, and as you can see from here, which is a spiral shape. Now let's discuss how the Lyme disease spreads. It's spreading through biological vector, our very old known one, which is zoonotic. It's more endemic in North America, Europe, and Asia. So now let's say we have the primary reservoir or the primary host here, which is this uh, this mouse, and now you have a tick. Mouse transmitted to the tick, and then the worm get to stay within the tick. Now the tick moves it uh to another phase, and then from here the tick, and then the tick grows and then can bite either the human and transmit it to the human, or can transmit it to a deer, and then the tick then reproduces, both male and female mating there reproduces, and then give more give more of these eggs, and the eggs can then hatch within let's say a month, and the cycle keeps going on and on and on. Next on our list is infectious mononucleosis. Um, this is mono or the kissing, we call it mono or the kissing disease. It's more common or more exposed within your teen years, which is basically you start dating and kiss a lot of people. You have about 20%, 25% of teens get this kind of infections, and it's asymptomatic and it's more common. Some of these symptoms include you getting the major one is you getting fatigue, and also fever, rash, headache, and swollen glands. So you have to be careful of the person that you kiss during your teen age that you are dating. And as I mentioned, it's more common in teens. So you get swollen glands, and then you have to visit the doctor if you have this, of these symptoms for you to be diagnosed. And you can also get this through direct contact, maybe through sports or through anything. So basically, you have to be more of a direct contact. But the most common form is through kissing. So you have to be sure of your partner before you kiss them. The next analysis is infectious. I'm sorry, it's caused by the Epstein-Barr virus. And it shares morphological and antigenic features with other herpes virus that we know. And then it contains DNA that is readily spliced into your host cell DNA. So we've discussed that virus enter your cell and you have to splice and insert itself into your host DNA. It's latent. It's latency and have the ability to splice into your host DNA and allows for immune evasion. So even if you clear the host cell, if you clear the virus itself, the DNA is still present in your body. The mode of transmission is direct and indirect contact, and also through parental transmission. Next on our list is anthrax, which is a zoonotic disease, and is zoonosis of the herbivores. There are three forms. We have cutaneous, pulmonary, and gastrointestinal, and the symptoms depend on the form that you got, and if untreated, will result in death. So livestock is mostly the biggest target for this disease. So it's transmitted through vehicle. It can be air, soil, indirect contact such as animal hides, and also food. It's caused by the Bacillus anthracis, and which is a gram-positive endospore forming rod in the soil. So this is what we can see from here. And then it forms a tripartite toxin. So you have these toxins, which is more of an edema factor and a protective antigen, which will lead to lethality, which is also having the lethal factor here. So that's how it works. So you have an anthrax, which can be cutaneous, or you get it from inhalation, or let's say ingestion. You ate a meat or an animal which is having this anthrax virus present. So now you get it. We have the inciting bacteremia phase here. Then they release the toxins, which is going to lead to edema toxin factor here, as we discussed, which causes a vascular leakage, increase in your blood vessel, your blood flow, causing vascular leakage, which leads to the pulmonary edema phase. Then we also have the lethal toxin, which will attack your heart, leading to hypovolemia. And then we also have which lead to hypovolemia, and in some cases you have more of a severe blood pump blockage. A blockage of the blood pump, which leads to you having stroke, and then leading to cardiac arrest, and you have hypotension leading to you being dead. And then sometimes the lethal toxin can also attack your macrophages, which leads to severe phenotypes in your lymph node, which will lead to impaired immunogenic response and leading back to your body attacking itself. So the next on our list is hemorrhagic fever disease. So they are agents that infect the blood and also your lymphatics. They are characterized by extreme fever, which is accompanied by internal hemorrhage. They are caused by viruses which are RNA enveloped. There's a prevalence in fluctuating due to their prevalence is fluctuating due to global warming patterns. So it goes up and down. For that reason, their prevalence is going up and down too. Um, these viruses that causes this hemorrhagic fever disease causes this downstream disease that we know, which is dengue fever, chikungunya, Hanta or Marburg, and we also have the laser viruses. So now let's take it one after the other. First one is dengue fever, which we call the breakbone fever. It's more popular or endemic in the southern Southeast Asia and in India, and also in South and Central America, the Caribbean, and also in Mexico. Symptoms include you having severe pain in your muscles and joint, which does not cause fractures. And there is also dengue hemorrhagic fever, which has a high rate of mobility and also mortality. It's caused by the dengue virus or flavivirus. It's transmitted through this vector, which is Aedes mosquito. So these places have these mosquitoes more prevalent. That's why they are being prone exposed to this disease. Next on our list is Ebola, which is caused by the Ebola virus or the Marburg virus. Symptoms are similar to that of the dengue fever because they all those viruses belong to the same group as we discussed earlier on. Um, The virus causes capillary fragility and also disruption of clotting. And mostly, if your blood cannot clot, it leads to patient bleeding from orifice and also mucous membranes, and they experience massive internal and external hemorrhages, which is basically bleeding. Um, there's a mortality. The mortality rate for this Marburg is mostly around 25%, and then mortality for Ebola is around 70%. No effective treatment for either disease is known, so you have to try and protect yourself. It's transmitted through direct contact and also through bodily fluids. Now let's talk about the non-hemorrhagic fever diseases that we know. These diseases are just characterized by a high fever, but without capillary fragility leading to hemorrhages. So you just have the fever, you don't have the hemorrhages. These are caused by bacteria. So we have the Keel fever, we have brucellosis, we have cat scratch disease, we have trench fever, and the list goes on and on. We also have the Rocky Mountain spotted fever. Now let's talk about the Rocky Mountain spotted fever. It's caused by Rickettsia rickettsii, and the transmission is through hard ticks. So if you have place you are exposed to places where you have a lot of hard ticks, you have to be careful. It mainly occurs in southeast and eastern seaboard regions of the United States. So you have Canada and Central Southern America. Then it's also sorry, it's more prominent in the southeast and eastern seaboard regions of the United States, and also more prominent in Canada, Central and also Southern America. Symptoms include chills, fever, headache, muscular pain, and then you experience a distinctive spot rash which occurs within 2 to 3 days after you getting infections. And then if untreated, you have lesions that will merge and become necrotic on your skin. It also leads to cardiovascular disruption, leading to hypotension, thrombosis, and worst case scenario, hemorrhage. There's a 20% mortality rate if you don't get treated. And then we have 5 to 10 mortality rate even if you get treated. Next on our list is the most common one, which is malaria. Um, Symptoms occurs within 48 to 72 hours intervals once you get exposed. What you experience is malaise, you have fatigue, you have aches, you have nausea with or without the diarrhea. You have chills, you have fever, you have sweating. And if you are infected with falciparum malaria, you have persistent fever, cough, and weakness for weeks without relief. And then if you have the cerebral malaria, you have your small blood vessels in the brain become obstructed, leading to coma and death in extreme cases. It's transmitted through the biological vector, which is the female Anopheles mosquitoes, and this is more of a vertical transmission. So let's dig into malaria. It's caused by the Plasmodium species, so it can be from any of these Plasmodium species. It can be from P. malariae, P. vaccis, Falciparum, ovale, and also Knowlesi. And it affects basically your red blood cells, which causes damages in your red blood cells. It's restricted to belt extending around the equator, so um, mostly around this is the equator, so mostly around places which have the yellow, which have the yellow coloring on the map. These are the places that mostly have malaria. There's been 200 million new cases reported per year, which is 90% more prevalent in Africa. You have about 500,000 to 1 million deaths annually if left untreated. So what is the transmission? We have the asexual phase, which happens in humans, um, where you have the female Anopheles mosquitoes just bite humans and transmit it, and then the parasite gets to live within the liver of the human, and then it gets to multiply and causes more disease. And then another mosquito bites the infected humans and pick it and also send it to another non-infected human. So you have both the sexual phase happening within the human and then the sexual phase happening within the mosquito itself. Next on our list is AIDS, which is acquired immune deficiency syndrome. It's caused by the HIV virus. Um, Basically, what it does is it causes defect in your helper T cells. So if your helper T cells are not functioning nicely, it means you can trigger immune response within your body. It was isolated in the 1980s, and then it became more popular. As we know right now, we have two types. We have the HIV-1, we have the HIV-2, which are known to exist. These viruses get permanently integrated into your host genome. That's why it's very difficult to get. It's very difficult to tackle them because the virus itself contains a reverse transcriptase, which will catalyze their replication, doubling their strands, and then the virus also can the viral DNA gets permanently engraved into your host genome. So even if you clear off the virus, the DNA is still present in your genome, which is something we can take care of it unless maybe in the near future um, um, we've developed therapies such as CRISPR-Cas9 to maybe recognize the HIV sequence and then cut it out. If not, then that's it. Once you get it, it's more like you are leading to your death, basically. You have to be truthful. Once you get it, that's it. Um, Initial symptoms include fatigue, diarrhea, weight loss, and neurological changes. This, in some cases, because it decreases the efficiency of your immune system, it gives opportunity for opportunistic infections and also neoplasms. You have severe immune deregulation, hormone imbalance, and metabolic disturbances, which will lead to weight loss, diarrhea, poor nutrient absorption, and you also have lesions. In some cases, you have lesions on the brain, meningitis, you have spinal column, and also peripheral nerve damages. So as you can see, the list goes on and become worse and worse once you get this disease. And basically, the symptom, as I mentioned earlier on, is tied to the level of viruses and also the level of your helper T cells or your T cells in your body. So as you can see from this graph, the green represent the level of the virus antigen, and then the yellow represent the level of antibodies to one or more HIV antigens, and then the the purple is the level of your T cells. So as you can see, initial infection, then you have a huge spike of virus antigen present, and then it goes down and then it keeps going up again. Why? Because now it have the huge spike, your body deals with it and takes some of the virus out. But remember that this virus is going to integrate into your host genome. So the viral DNA is going to integrate into your host genome. So the virus itself has been already cleared out by the body because now your body start producing antibodies and clear out the virus itself. But the problem now comes in with when the viral DNA is already incorporated into your genome and then it gets replicated and it kept causing more problem. So the virus itself is not there, but the DNA is present. For that reason, um, as you can see from here, the green start going back up again because now is the viral DNA is still replicating itself, and it puts so much pressure on your helper T cells, and now your T cells are not able to catch up with the amount of the amount of proteins which is secreted or generated from the viral DNA which is incorporated in your genome. So as you can see, the T cells levels goes down, and once your T cell level goes down, that's problematic because then your body cannot recognize the antigens which is basically produced from these viral encoded DNA in your body. So T cells can recognize them, your B cells can recognize them. You basically all of your immune innate acquired immune system is down. Then it's very problematic because you can't defend yourself now. So, the mode of transmission can be any form of innate contact involving the transfer of blood, and you can also have it's also sexually transmitted. When the mom have it and then breastfeed the kid can also get it through breast milk. You can get it through urine, tears, sweat, saliva. I'm sorry, urine, tears, sweat, and saliva are not considered sources of infection. For that reason, if someone have it, as much as you have to be careful around them, you don't have to make it more stigmatized because they have HIV. Just have to make sure you don't get any of these forms of infection from them, but any of this is fine, saliva, sweat, and urine. But you have to still protect yourself, obviously. There have been antiviral chemotherapy and variety of drugs to prevent or treat the opportunistic pathogen infections. There are three drug cocktails containing reverse transcriptase inhibitors. So you just get in there and prevent the virus from, using their reverse transcriptase to integrate into your to generate DNA, which will later be integrated into the host genome. So there are drugs available for that. So about 46 percent of infected HIV patients are not aware of it because it kind of the symptoms kicks in a bit late. So you get exposed to it several months before you can kind of realize you have it. So you have to be careful. So this is all I have for you for today. See you guys in class on Friday. Okay, bye. Stop sharing.